Hi, good evening. My name is Rachel Dunlap. I am a student at Colorado Christian University, and I'm currently taking a class on healthcare policy and law. And we were asked to do a brief 3 to 5 minute video on something that we have learned over the last 3 weeks that really has impacted on the ways that we thought about healthcare policy and law, and how it's going to affect how we do our job in the future. A little bit about myself. I am a full-time student at Colorado Christian University. I also work full-time as a nurse, and I consider myself to be a Christian. Now, I say that to lay groundwork for what I'm about to talk about. This past week, we have talked about public health and safety, and public health versus individual rights. And with everything that has been going on with COVID-19, there has been a lot of questions and a lot of controversy on whether or not the state, local, and federal mandates that have been put in place to try to stop the spread of COVID-19 has infringed upon the rights of the individual. I was asked how I felt about the states saying that churches could not gather in worship as a public health safety versus an individual right. And as a Christian, I want to say, nobody's allowed to tell me where and when I can worship God. But as a nurse, I want to say, yeah, they need to slow the spread of COVID-19, and we do this by not gathering in large crowds and then possibly contracting COVID-19 and taking it home to our families. This is how germs are spread. So it's a fine line for me. I kind of have to look at it not only as a Christian, but also as science. So then, we get to thinking, well, when does science overtake the importance of individual rights? And in the Constitution, there was policies put in place so that the government or the local governments, state and local governments, could implement what is considered to be police powers. Now, police powers are put into place to protect the safety of the health. Put in place to protect the public's health, safety, and well-being or welfare. These policies cannot be used or initiated in order to punish. They can only be enacted in order to keep and ensure the safety of the public. So with that being said, people are talking about, like, let's say the mask mandate. Well, you can't do that. You can't force me to wear a mask because it's not a law. It's a mandate. Well, with the way that our Constitution is set up with police powers, they have the right to mandate and to enforce those mask mandates because it is a public safety issue. Now, don't get me wrong, I don't like to wear the mask. I have to wear them at work, then I have to come home and wear them, and then I get it. I get it. But we have to be concerned about our fellow man just as much as we are concerned about ourselves. And that is the Christian in me, as well as the nurse. But one of the biggest things that I found to be extremely interesting in regards to police powers is it's not like a forceful intake of military, like, oh, you have to do this, but they use coercion. Okay, what's coercion you mean? Basically, they have an idea, they have a thought, and they convince you to agree with their thoughts. Who knew? It's like my kids. Anyways, I'm trying to hurry up and get this done, but it was interesting because basically what they do is they convince other people to follow along with what they feel is public health and safety, or for the benefit of public health and safety, and eventually that turns into a policy, which is then in turn turned into a law. Let's take secondhand smoke, for instance. If initially it was restaurants, you couldn't smoke in a restaurant because People are trying to eat. You're exposing non-smokers to secondhand smoke. And then they moved it to like, grocery stores and federal buildings and hospitals and places like that. And then eventually it turned into um, a, a local issue. Locally it was enacted everywhere. If you were in a certain county within a certain state, then if you were in a building of any type that serviced the public, then no one could smoke within that building. Now it's pretty much countrywide. You can't go anywhere and smoke within a building. Um, and this is the perfect example of coercion. The local health department got together and said, hey, this is really bad for public health. And then they convinced other people that it was bad for public health. And eventually it has turned into laws. Um, and so I found that really interesting. I don't know why. Maybe because when you think of police powers, you think of, the military coming in and forcing you to do something. But it's not like that at all. And then we were asked to talk about how that affects, um, or how the insurance, the health insurance update of 2015. I know I'm saying that wrong, but basically what it was is it was like a reconfiguration of the ACA where they, took some stuff out and they put some new stuff in 2015. And so it doesn't really like that particular thing does not really affect like police powers and the coercion and all of that stuff in regards to, you know, convincing people to do something for the safety of the public. But what it does do is the ACA really did affect public health because, more people have insurance than ever before with the expansion of Medicare and Medicaid. They forced insurance companies to no longer punish people for having pre-existing conditions. Like, you can't help that you have heart disease, you know, that's just not something that can be changed. I mean, if you have it, you have it. So why are you punished with your insurance? Another thing that they also did was they had forced insurance companies to pay for things um, like mammograms and yearly physicals and colonoscopies and things that people generally couldn't afford but were necessary for their health because early prevention can stop, like if we find colonoscopy early, it's completely curable. If we find prostate cancer early, it is completely curable. Um, so now that people are able to have these tests done under the under the ACA, mandate that their insurance companies cover these tests at 100%, that affects the public health because more and more people are getting tests that they normally wouldn't have. But overall, I've really have learned a lot over this. I look forward to the next couple weeks and what I'm going to learn. And I appreciate you all taking this journey with me. I was supposed to do 3 to 5. I'm at 8 minutes. But I do appreciate you taking this journey with me. I hope you learned a little bit and found it as interesting as what I did. Thanks. Have a good evening.